This National Institute for Health and Social Care Research funded project was designed to investigate how much pay varies for the frontline workers in England who deliver adult social care, together with the effects of different pay systems on their skills, career progression, and whether or not they leave their jobs. It also considered the effects of local authority fee levels on pay. Adult social care provides support to vulnerable and elderly people, mainly in their own homes or in nursing and residential homes. In 2022 to 2023, over 850,000 people used adult social care services in England, and these are vital to their quality of life. As our population ages, even more people will need this care, meaning that we will need a larger workforce. But already we don't have enough workers. In 2023, there were 152,000 vacancies, nearly 9% of the workforce, and 30% of workers, nearly 1 in 3, left their jobs. We know that pay has an important role to play in the difficulties of recruiting and keeping workers, and this research is important in helping to understand that. What did we do? We used data collected by Skills for Care for frontline workers, and we also collected our own data using a survey and interviews with firms that provide care and their employees. What did we find? Overall, we found that pay is low and doesn't vary much. By that we mean that most care workers earn at or around the national living wage, and their pay does not increase, or not by very much, when they gain qualifications or experience. Senior care workers earn only a few pence per hour more than care workers, and so many care workers are reluctant to take on more senior roles. Women, ethnic minorities and non-British nationals also receive lower pay. Other benefits, such as pensions, annual leave and sick pay, are also mainly at the lowest levels allowed by legislation. Most care workers are employed by private sector firms, and their pay is on average 14.7% lower than care workers employed by local authorities, who also offer better benefits. There is also a big difference in pay and benefits between adult social care workers and similar workers in the NHS, for example healthcare assistants. Offering care workers similar pay and benefits to the NHS could be important in attracting more people into adult social care and keeping them in their jobs. In interviews, private sector care firms told us that local authority fees often do not cover the cost of care. Many also offer care to people who are self-funding to make up the difference. They also told us that lack of funding leads to low pay and poor benefits. Different local authorities also pay different fee levels, which makes deciding pay rates complicated. And the funding firms receive is often insecure, leading them to use 0 hours contracts. Many care workers would prefer guaranteed hours contracts, meaning those on 0 hours contracts are more likely to leave their jobs. Importantly, pay rates do not reflect the level of responsibility that care workers have, and there is no pay structure that increases pay for gaining qualifications or experience. What does influence what care workers are paid? We found 2 main things. 35% of differences in pay are linked to the workers themselves, for example, their personal qualities and values. These are obviously very important, but qualifications and experience need to link to pay increases to offer career progression. This will also help raise the status of care work, which is usually considered to be low-skilled. Not linking pay to qualifications and experience might make it difficult to attract more people into care. 22% of the differences in pay are linked to a firm's strategies. Some, for example, offer a higher rate of basic pay, but no overtime payments to make the pay as competitive as possible. We also found that pay plays a small but important role in whether care workers stay in their jobs. If they are not happy with their pay, many move to other care firms that pay slightly more. Working conditions are also really important. For example, workers are more likely to leave where there are staffing shortages, they have 0 hours contracts, and they work under too much pressure. They are also more likely to leave if they are women, ethnic minorities, and non-British nationals. Two other things are important in keeping workers in their jobs. First, worker priorities explained around 1/3 of this, and include the satisfaction of caring, flexible working, variety, being able to make decisions independently, and career opportunities. Personal circumstances and convenient working times are also important, as are health and well-being support and training opportunities. Second, workplace culture explained about 15% of why workers stay, and includes good leadership, induction training and rewards, such as bonuses and staff recognition schemes. Many care workers told us, however, that they did not get enough support from their managers and often did not feel valued. What are our recommendations? First and most importantly, higher basic pay rates and improved benefits are needed. A pay structure that rewards gaining qualifications and experience for care workers is also needed, together with higher pay for senior care workers. A sector-wide minimum wage and pay structure would support this and support career pathways for care workers. Increased government funding is needed so that local authority fees can be at the level needed to improve pay and benefits. Local authorities should also make their fee payment processes more stable. Second, pay monitoring for matters like gender, ethnicity and nationality is needed to make sure that pay processes are fair. Leadership training is needed to support this and also to help firms understand how to create strong workplace cultures and offer good induction and reward systems. Finally, meeting worker needs is vital and will require flexible working systems, health and well-being services and realistic workloads. We know that most care workers love their jobs, but many feel underpaid and undervalued. This makes it hard to recruit and keep them in care work. Our research has identified many challenges and suggested some solutions. Addressing these is important and helps the government to identify the changes needed. Tackling pay and benefits is critical to building a bigger workforce and ensuring they have positive working experiences. This will also improve the care delivered. Getting this right will also benefit the NHS, as a better adult social care system will mean fewer people go into hospital, and where they do, they will be able to be discharged when ready, avoiding the bed blocking that we hear so much about.